Hi, this is Dr. Praveen Tripathi, Faculty Conceptual Psychiatry. So this video is for new residents. Either you have joined Psychiatry Residency or you have been allotted psychiatry in one of the colleges and you're about to start with it. So how should you approach it? Now that you had a long break with all the counseling getting postponed and you have done your fair bit of enjoyment and now you want to get serious, you want to start residency on a good note. If you have gotten a couple of days with you, what I would strongly advise is that get your basics right. Majority of the students do not read psychiatry in their MBBS and later on they watch some videos and they pass the entrance examination. That is good enough to crack the exam. But if you are entering psychiatry residency, your basics should be clear. I have written a book with JP Brothers, Textbook of Psychiatry from Concepts to Clinics. So you can look for that book on Amazon. It's a small book, I think 180, 190 pages. And if you have learned from me through videos or notes, you would be able to match a lot. It would be in sync. So you can, it should take like 4 or 5 days for you to complete that book. Complete that book before entering your psychiatry residency. Why? If you enter residency with your basics right, at least in the beginning, the theory part would be taken care of. Now, say you have started with the residency, what now? The initial part would be learning how to take history and MSc, mental status examination. That is going to be very important. First of all, in the initial couple of months, you should be focusing more on seeing patients and learning from the patients than anything else. That should be your primary goal. But even to do that, you'll have to have some fund of knowledge. So history taking, MSc, understanding how to take a case, all these things are important. So as many of you would be available, we have a Conceptual Psychiatry app, which is for psychiatry residents. The name of app is now Conceptual Psych, P-S-Y-C-H, because it has got 2 components for psychiatry residents and psychology students. So you can go to the Conceptual Psychiatry app, and there in the first section itself, you would see history taking. It has been taken up by Dr. Hiral Kotadia, who's a very distinguished child psychiatrist. And then comes the part of MSc, which is also taken by Dr. Hiral, and then psychopathology. When you go to the department, the first thing probably they will tell you is to start reading Fish or Sims. Now, Fish and Sims are books of psychopathology. They are standard books. Everybody should read them. Like we do, just to make them simpler, psychopathology part, we have made videos. There's a section in the app called as Psychopathology. I have taken majority of the lectures in that section. So starting from what exactly is psychopathology to disorders of perception, disorders of thought, all those things have been covered that you need to know in the beginning. At least perception and thought you must be aware because you would require that while taking history. So the section on history and MSc, the section on psychopathology, this would be important. As you continue with your residency, you would start reading about schizophrenia and mood disorders at least, because these would be the disorders that you would be seeing in the wards every day. We have created videos which are based on CTP, your comprehensive textbook of psychiatry. Like we always do, we have tried to make it easier for you to understand. It comes with the notes, of course. So you'll start understanding some basics of the disorders that you are seeing in the clinics and in the ward. That said, beyond these, you can stop. Just these things. Again, to summarize, history taking, MSc, psychopathology, later on schizophrenia and mood disorder. And one more thing, in the app you would see the section of long cases, right? So you can see that section in which different faculties have role played. One of them has played the role of a student who is presenting the case. One of the faculty who is asking questions. So you can see in cases at least of schizophrenia, depression, OCD, how are the cases being presented. That will tell you how to take a case, what all things must be included. And if you have time, you can see the section where the Viva part is being enacted so that you know what questions are important. So a couple of these things, but spend time with the patients. Spend time with the patients. In residency, patients are your biggest teacher. They teach you a lot. In the beginning, you might feel a bit befuddled that, the patient keeps on speaking. There are so many things he's telling you, how to extract important points from it, how to diagnose delusion from whatever he's telling, how to diagnose hallucination from whatever he's telling. All of these things you would gradually learn. but learn to spend time with patients, right? I would say don't be in a hurry to go back home at 6 o'clock or 5 o'clock, even if your department allows it. Spend some time with patients. Taking history, detailed history, you should give it some time. For MSc, you can watch it from the app. Else, you can also go and read the standard books. For MSc, we have multiple standard books. You can use them. So yeah, these are the things. Psychiatry residency in the beginning may appear a bit confusing because again, it's slightly different from what you have been seeing in the wards and the OPDs till now. But you'll get a hang of it gradually. So, and this is a first year syndrome. To residents from multiple branches feel it in the beginning. Whether you have joined medicine or surgery or OBG or psychiatry, you may initially feel a bit of difficulty for two reasons. First of all, you find it difficult to adjust to the branch. Give it some time, it will happen. Second major problem is you go from being a student to being a professional. Right? As a student, you have a lot of leeway. मन नहीं किया पढ़ने का तो नहीं पढ़ा. सुबह उठे, you don't feel like doing anything. You said that okay, I will take a break today. But as a resident, you can't do that. You have to go to the hospital. Whether you are feeling like it or not does not matter. If you take a off today, second day off is almost impossible. You are answerable to your senior residents, to your second, third year PGs, to consultants, to the patients. And if you are not doing the job, somebody else has to do it because work has to be done. So that adjustment from being a student to being a professional takes a bit of time. Reaching hospital at time, not being able to leave early, finding out time to have lunch, managing your co-residents, developing a good rapport with the residents, developing a rapport with the nursing staff, all these things you'll have to learn. So initially it might be a bit overwhelming, but give it some time. You'll settle down into this new role. Things will start happening. You'll start enjoying it also. It will be stressful. You'll have to present the case. You will be, people will ask you questions during the case presentation. It tends to become a bit rigorous at times. It tends to become a bit difficult at times. But gradually, things start happening, right? Be respectful towards your seniors. Majority of the seniors, once they understand that you are being respectful, that you want to learn, they tend to become nice. You would come across certain toxic people in the department, which are everywhere. Try not to, get entangled with them. Try to avoid them. If they want some superficial respect, give it to them, right? Try to make things easier for you. And things will start happening. So, yeah, these are some of the points. And as you continue with the residency, as you enter second year, third year, there are different things in the Conceptual Psychiatry app that you can use. We have made videos for all the important topics. We are starting to make videos for MRC Psych. We have made rapid revision videos which are being used by the exam-going students. Notes are there. Everything is there. But you don't have to access everything in the beginning. You just have to focus on 3-4 main things that I talked about. So, again, welcome to the residency. It's going to be difficult, but you'll start enjoying it with time as time progresses. And you have joined a good branch. Things will fall in place. Keep working hard. Best wishes.